Hello, my name is Fraser Buse, and I am doing my presentation on visual attention in complex scenes. What is attention? Attention is a critical cognitive process that plays a pivotal role in how individuals perceive and respond to their environment. Defined by Treisman in 1988 as a process which results in certain sensory information being selectively processed over other information. Attention enables individuals to focus on particular stimuli whilst disregarding irrelevant or distracting inputs. This selective and conscious attention allows us to navigate complex environments, making it possible to engage with the most pertinent aspects of our surroundings whilst filtering out distractions. In many professions, attention is not merely important, it is paramount. This is particularly true for those working in high-stakes environments such as medicine, where a failure to maintain adequate attention could have life-threatening consequences, or in fields like airport security, where a lapse in attention can lead to severe security breaches. In this presentation, I will explore the concept of attention, particularly in attentional blindness, and illustrate the importance of attention in high-risk professions, with particular emphasis on medical imaging and airport security. Attention, by its very nature, allows individuals to narrow their cognitive focus to specific information whilst filtering out the excess stimuli that may overwhelm their processing capacity. This cognitive resource is finite, and as such, we are often compelled to prioritize certain types of information over others. This is particularly relevant in professions where the consequences of inattention can be catastrophic. In the case of medical practitioners, such as doctors and radiologists, the ability to focus on crucial details in medical imaging is essential for ensuring patient safety. MRI and CT scans, for instance, provide invaluable insights to the health of patients, offering images that allow doctors to diagnose conditions ranging from cancer to broken bones. The role of attention becomes apparent when considering the complexity and volume of data these medical professionals must sift through. A lapse in attention, such as failing to detect an abnormality on a scan, could result in a delayed diagnosis or, in the worst case, misdiagnosis, which could be fatal for the patient. Another example would be the case for airport security, where security personnel must remain vigilant in their assessment of X-ray scans of luggage. These scans reveal a wide range of objects, from benign personal items to potential threats, such as weapons or explosives. Attention is critical here as well. Security personnel must be able to identify minute details amidst a large volume of scanned images. Failure to detect these could result in loss of life or significant damage. However, even when attention is considered essential, human cognition is not infallible. One phenomenon that has profound implications for attention in such fields is inattentional blindness, as previously mentioned. In the following sections, I will explore the nature of inattentional blindness, its impact on decision-making in high-risk professions, and its potential to lead to catastrophic errors. The term inattentional blindness was first introduced by Simons and Sabris in 1999, who defined it as the failure to fully notice a visible yet unexpected object when entering the visual field. They argued that without attention, visual features of our environment are not perceived at all, or at least not consciously. Observers may fail not just at change detection, but at perception as well. This concept is particularly striking because it highlights a fundamental limitation of human attention, that even when an object is clearly visible within our field of view, we may not perceive it if our attention is directed elsewhere. The key element of inattentional blindness is the selective nature of attention. Our brains are constantly filtering sensory information, and the only stimuli that can capture our attention is processed consciously. As such, objects or detailed that fall outside our focus can remain unnoticed, even if they are right in front of us. One of the most well-known experiments is illustrating inattentional blindness was constructed by Simons and Chabris, where participants were asked to watch a video of two teams playing basketball, passing the basketball, and count the number of passes made by one team. During the video, a person in a gorilla suit walks in the scene, pauses, then exits. Despite the fact that the gorilla is visible for several seconds, approximately half the participants failed to notice it due to the intense focus of the passes. This experiment underscored the limitations of human attention, revealing that when we are highly focused on one task, we can completely miss other often obvious events. Within the medical profession, inattentional blindness has serious implications. A prime example of this is in the study by Drew et al., which examines the effects of inattentional blindness on radiologists. In this study, 24 radiologists were asked to review a series of medical images for lung nodules, which could potentially indicate the presence of lung cancer. After reviewing a number of regular lung nodule images, the radiologist was shown an image that contained not just a regular lung nodule, but a prominent image of a gorilla. Remarkably, despite the gorilla being 48 times the size of a human lung nodule, 83% of the radiologists failed to notice the gorilla in the image. This failure occurred even though the radiologists were highly experienced and accustomed to reviewing similar images. The results of this study demonstrated the dangers of inattentional blindness in the medical field, and when radiologists are focused on identifying minute details in an image, they may overlook critical elements, even those that are highly conspicuous and would be immediately noticeable under different circumstances. In the case of medical imaging, such oversights can have dire consequences. If a radiologist fails to detect a potentially life-threatening condition, such as lung cancer, it may delay the treatment that the patient needs, which ultimately results in death. Moreover, inattention could lead to incorrect diagnoses or misinterpretations, resulting in the patient receiving maybe inappropriate treatments. These findings are not isolated. The phenomenon of inattentional blindness has been observed in other medical fields, such as in the emergency room, where clinicians may fail to find key symptoms or abnormalities in a patient condition due to the overwhelming nature of information that they must process. And even in highly regulated settings, such as surgery, where surgeons are required to attend to multiple details at once, errors due to inattentional blindness can have devastating outcomes. In airport security, security personnel in airports are tasked with screening a vast number of items in X-ray machines every day. These machines provide a detailed image of the contents of the luggage, which may include a mix of innocuous personal items or dangerous objects. such as weapons, explosives, or contraband. In this environment, the ability to focus on the relevant details of a scan whilst filtering out irrelevant information is crucial. However, the human cognitive system is limited, and security personnel may become fatigued, distracted, or overwhelmed by the sheer volume of scans they are required to process. A more direct link to airport security would be Donnelly in 2010. Participants were looking for multiple dangerous items within each bag. The results showed that the factors affecting salience, items, or behaviors being noticeable could affect the visual field of participants because of the rich environment, such as multiple dangerous items. Ways to combat this would be to change the screening process and possibly training methods because of how the contraband looks on the system. Given the potential consequences of misdetections in airport security, such as the infiltration of dangerous materials or the possibility of terrorist attacks, it is clear that the stakes are very high. For counter-arguments, some researchers argue that inattentional blindness might arise due to perceptual processes that are not directly related to attention as traditionally assumed. For example, rather than missing the object entirely, the object may be processed in a very limited and or superficial way, making it harder for the individual to consciously recognize it later. This interpretation suggests that inattentional blindness is not necessarily about complete unawareness, but about shallow processing or incomplete perceptual encoding. Supporting this would be Simons and Ambinder, who discuss a phenomenon called change blindness. In their research, they used a task by Rensink et al. In 1997. And their explanation for the change blindness was that movement of the eye limits perception, and this is known as saccadic suppression. Another explanation could be rapid eye movement blurs the retinas that makes you unable to see the change signal in the task. Another counter argument would be the spatial working memory. For example, in Orr and Vogel's study, they concluded that there is a connection between spatial working memory and the ocular motor system, and therefore has an effect on attentional shifts in the earlier stages of development. To maintain spatial working memory, attention-based rehearsal is the most effective way of remembering specific things or items. To conclude, inattentional blindness is a phenomenon that underscores the limitations of human attention, particularly in high-stakes environments such as healthcare and airport security. To mitigate these risks to causing harm in these professions, it is crucial that these professionals are trained to recognize the limited ability of their cognitive processing and implementing strategies to minimize the effects of inattentional blindness. By understanding the impact, we can make sure that these professionals are safeguarding lives and maintaining security in the highest pressure of situations. Here are my references, and the YouTube link will go at the end of the slide. Thank you very much for listening to me. I hope you have a good day.